For our research project, we did air pollution exposure in marginalized neighborhoods in the US. The World Health Organization attributes 1 in every 8 deaths to air pollution. Indoor and outdoor air pollution rank among the highest risk factors of disease, landing in 4th place and 9th place respectively.
We have spent countless hours looking at studies concerning air pollution and its effects on marginalized populations. As students, we feel that bringing more attention to the topic of air pollution can act as more evidence of why measures should be taken to reduce air pollution. Air pollution is something that impacts all of us and can lead to life-threatening medical conditions. Air pollution can result in cancer, heart disease, and respiratory illnesses. As the world becomes more polluted with trash and harmful chemicals, communities with pre-existing vulnerabilities are at an even higher risk of danger. While carcinogens found in air pollution affect all of us, they affect marginalized communities such as people of color and women the most.
We will first discuss how pollution is harmful and leads to health disparities, both physical and mental. Then we will discuss how minorities are the most exposed to air pollution through inequalities in housing, income, and healthcare. We will finish by looking at the consequences of air pollution and how women end up being the ones who shoulder the heaviest burden.
Pollution has a lot of negative health effects. There are 2 main types of pollutants. The first one is particulate matter, which includes tiny particles of dust as well as liquid droplets suspended in the atmosphere. The second type of pollutant is gases, which include nitrous oxides, benzene, and ozone. There are a lot of different ways that pollutants get into our atmosphere. One of the biggest ones is greenhouse gases and an increase in climate change because of it. As the world becomes even more industrialized, we see a higher prevalence of carbon dioxide, methane, nitrous oxides, and fluorocarbons. Pollutants also come from transportation like cars, heavy metals from industrial processes, sulfur dioxide from coal combustion, and benzopyrene. Benzopyrene is another pollutant that comes from things like vehicle exhaust and domestic wood or coal fires. Specific effects of benzopyrene exposure include damages to the reproductive system, respiratory tract irritation, and can lead to cancer if exposed to for longer terms. Another common pollutant is carbon monoxide, and that gets into our atmosphere in a lot of ways. Prolonged exposure to carbon monoxide can cause a person to have headaches, nausea, dizziness, and decreased lung function. Overall, it causes a person to feel sick a lot of the time and have a general lower quality of life. One of the most common health effects from pollution is asthma, specifically short-term asthma found in children. It is mainly attributed to nitrogen dioxide exposure, one of the main pollutants from transportation and combustion. According to the article, Early Life Air Pollution and Asthma Risk in Minority Children, close to 44% of all asthma incidences can be related to environmental factors, including air pollution. Short-term asthma is most commonly found in children, but more specifically children of racial minorities. Latino and African American populations generally live in areas with the highest amounts of pollution and also tend to have the highest prevalence of early childhood asthma. It was found that Puerto Rican communities have the highest rates, and then African American communities follow second. Pollution also has a lot of proven negative effects on the cardiovascular system. In an analysis done on China by Michael Brower, a professor at the University of British Columbia, he noticed that China has both high levels of pollution and high incidences of strokes. Brower observed that an increase in particulate matter and common gaseous air pollutants had a significant association with admissions to hospitals for strokes, as well as a higher mortality rate from strokes. Associations were strongest when the strokes correlated with exposure of the same day. Another cardio-related health effect is heart disease. The biggest concern for this is a tiny particulate matter that is less than 2.5 microns in diameter, also known as PM 2.5. These particles are small enough that they are able to travel through your body's filtration system and are then able to travel to the lungs. More and more research is also coming out about how pollution relates to other health issues and diseases. Things like diabetes, low birth weight, and preterm birth are all shown to be affected by an increase in air pollution. As research is being done on this, we are gaining a better understanding of air pollution's role in systemic inflammation, which then affects many organ systems within the body. Pollution not only affects physical health, but mental health as well. In heavily polluted areas, we tend to see higher levels of stress and anxiety, and this happens for many reasons. In Michael Brower's research article, Air Pollution, Stroke, and Anxiety, an exposure-dependent association was found between higher exposure to PM 2.5 and increased feelings of anxiety. Spaces with more nature end up having a higher impact on stress and anxiety, whereas spaces that are more heavily industrialized tend to make it worse. One of the most significant effects of pollution is cancer. There are 3 types of cancer that we see most commonly from environmental pollution, including lung cancer, leukemia, and breast cancer. The pollutants that affect lung cancer the most are nitrogen dioxide, ozone, and particulate matter. Mostly it comes from things like combustion of coal and emissions from transportation. Leukemia, with leukemia, evaporation and combustion of petroleum products releases benzene into the atmosphere, and then that is then attributed to leukemia. Overall, pollution leads to many negative health effects. This includes short-term asthma, cardiovascular issues like heart disease and stroke, as well as many different types of cancers. The people most affected are women and minority populations, as they are the most often exposed to the different pollutants that cause health problems.
Minorities are the most exposed to air pollutants. Here are 3 ways that they are vulnerable to pollution. The first way is that marginalized people are exposed to more pollutants due to their economic status. They are limited in where they can live, meaning that they have no other option than to live in poorly maintained accommodations, typically near a large amount of trash or chemical waste. Their low economic standing impedes their mobility to escape pollution and seek sufficient health care. According to the 2022 article, Racial, Ethnic Minorities, and Low-Income Groups in the U.S., which focused on disparities of fine particle air pollution, aka PM 2.5, among racial minorities. In 2016, the average PM 2.5 concentration for the Black population was 13.7% higher than that of the white population and 36.3% higher than that of the Native American population. Additionally, these air pollutants weaken the immune system and make developments of health issues more likely, especially for people of color. The article, The Burden of Air Pollution, Impacts Among Racial Minorities, written by Sharon Gwynn and George D. Thurston, states, socioeconomic status is the factor that has most consistently accounted for the observed differences in asthma prevalence rates between whites and blacks. For example, in New York City, asthma hospitalization rates by patient zip code were correlated with the percentage of minorities in the population and inversely associated with the median household income. Another way is that housing discrimination and red lighting force people of color to live in the least desirable areas, such as near landfills and chemical plants. Poor living conditions increase the likelihood of a person developing a life-threatening disease. According to the 2010 article Environmental Health Disparities in Housing, written by David E. Jacob, who states, disparities in asthma morbidity and mortality have been well characterized and have been associated with housing disparities and segregation. From 2001 through 2003, current asthma prevalence was higher in children than in adults, and African Americans than whites, in those of Puerto Rican descent than those of Mexican descent, and in those below the federal poverty line than in those at or above the federal poverty line. Because of poorly maintained housing, people of color are exposed to allergens from cockroaches, rodents, dust mites, fungi, and respiratory irritants, while also living near places with high amounts of waste or pollutants. Since they are disenfranchised and do not have significant economic influence, these people cannot prevent contaminants from entering their communities. Due to their status as marginalized individuals, access to health care and preventative care is limited. Their racial identities and their economic status limit their options for health care. Many cannot afford such resources, and when they can afford them, they are not met with responsive care that meets their needs and makes them feel seen. According to the study, Potential Barriers to the Use of Health Services Among Ethnic Minorities, published in 2006 and written by Emmanuel Shepers and 4 other associates, parents of the ethnic minority child patients experienced communication with the physician of their children more negatively when compared with their socially dominant counterparts. Differences in experience were associated with differences in understanding each other. There are many reasons why minorities use health services less. There are barriers that prevent them from seeking health care, such as a lack of finances, mistrust in the healthcare system, and poor communication from patient to provider. This concludes the section of discrimination. Minority groups are particularly vulnerable to environmental hazards such as air pollution. Several factors force minority groups to shoulder the burden of air pollution. The consequences of a low socioeconomic status and racial discrimination are two primary examples of how the burden is placed on minorities. When a person lives on the poverty line, they are relegated to the poorest living conditions, are nearest to harmful waste sites, and are limited in their ability to get help for health issues.
Women are the most exposed to the highest levels of pollution, both inside and outside the home. Women are also given the brunt of the responsibility in dealing with the consequences of air pollution, whether that means preventative procedures or restorative techniques. Women are most exposed to the chemicals of the household as they are the sole laborers of the home. The labor including cooking, cleaning, and heating. These household chores are both very risky and also infinite chores that will never end. Chemicals are detrimental during the application process and after the application process. Another indication of women being consequenced by air pollution in the home is when schools inevitably close, mothers have no choice but to take care of their kids and miss work. This furthers the notion of not being able to move to an area with less exposure and thus feeding the snake that eats itself continuously. Women suffer from air pollution exposure at work because they are more likely to work in an exposed area. Jess Taylor, in the article The Unequal Impact of Air Pollution on Women, says that women are overrepresented in informal community. This basically means that women cover entry-level jobs in low-income communities, and these happen to be jobs where they are exposed to air pollution the most. The lack of education on the risks of exposure, along with where the exposure is the most concentrated, furthers the risks simply due to ignorance and not knowing any better. The lack of accessibility and ability to get jobs that aren't in exposed areas also furthers the risks of complications. Air pollution provides many health disparities between men and women. For example, both asthma and heart disease are more common in women than in men. Women are more susceptible to tropospheric ozone, which causes cerebrovascular disease and leads to death. Air pollutants cause increasing risks of breast cancer that can and will affect future generations' health by seeping into breast milk. And specifically in Hispanic populations, Hispanic women have higher levels of risk of exposure to chloroform, which can lead to cancer due to the fact that they wash dishes by hand more often. Air pollution also creates major problems in pregnancy. It puts women at a higher risk of miscarriage, stillborn, and postpartum depression due to altering hormone levels. Certain levels of exposure to air pollution constitute the same risk of miscarriage as smoking does. And women of color are the most susceptible to exposure on top of disproportionate pregnancy and health complications that they already face. The only solutions to the problem of air pollution in marginalized communities focused on women is a conversation that needs to be had on all levels. A conversation where women and minorities are properly advocated for, and education continues to develop around this topic. To conclude, From a gendered perspective, women are more exposed to air pollution than men, both in the home and at work. Additionally, they deal with the brunt of the consequences that come along with air pollution, being the sole laborers of the house. Research and education on this topic is desperately needed in order to make sufficient change in improving air pollution levels in marginalized neighborhoods and communities for a slew of reasons, but specifically to untangle and lift some of the burden and labor that falls onto the women and mothers of these communities.
We will now show you a brief video.
Air pollution consists of chemicals or particles in the atmosphere that pose serious health and environmental threats. But what causes air pollution, and what does it mean for our planet? Some air pollution comes from natural sources like volcanic eruptions, wildfires, or allergens. But most air pollution results from human activities, such as energy use and agriculture. There are different types of human-made air pollution. When we burn fossil fuels to produce energy, they release greenhouse gases into the air. These emissions, such as carbon dioxide, methane, nitrous oxide, and fluorinated gases, trap heat from the sun in Earth's atmosphere, leading to a rise in global temperatures. This creates a cycle where air pollution contributes to climate change, and climate change creates higher temperatures. In turn, higher temperatures intensify some types of air pollution. For example, climate change increases smog because it forms in the presence of high heat and increased levels of ultraviolet radiation. More frequent extreme weather, such as flooding, contributes to damp conditions and therefore to a rise in mold. Warmer weather also leads to longer pollen seasons and therefore more pollen production. Smog is a type of air pollution that reduces visibility and has serious health effects. Smog can be divided into two categories: sulfurous and photochemical. Sulfurous smog is made up of chemical compounds called sulfur oxides. It occurs when burning sulfur-bearing fossil fuels such as coal. Photochemical smog, also called ground-level ozone, is a result of the reaction between sunlight, nitrogen oxides, and volatile organic compounds. Nitrogen oxides come from car exhaust, coal power plants, and factory emissions. Volatile organic compounds are released from gasoline, paints, and many cleaning solvents. Smog not only creates a brown haze that reduces visibility, but also harms plants, irritates the eyes, and causes respiratory distress. Another category of air pollution is toxic pollutants. These are chemicals such as mercury, lead, dioxins, and benzene that are released during gas or coal combustion, waste incineration, or burning of gasoline. In addition to adverse environmental effects, toxic air pollution can cause serious health problems such as cancer, reproductive complications, and birth defects. While air pollution has many consequences for our planet, there are solutions. We can limit toxic pollutants, smog, and greenhouse gases by decreasing the use of fossil fuels, such as in transportation, manufacturing, and electricity generation. Reducing air pollution not only contributes to a cleaner environment and better human health, but can also slow the rate of global warming.
To conclude, air pollution leads to a lot of health complications, including asthma, cardiovascular effects, and many different types of cancer.
Marginalized communities experience disproportionate exposure to air pollutants in three ways. They have lower socioeconomic standing, They experience housing discrimination and racial discrimination that prevents them from getting the access to health care that they truly need.
And women are the most exploited by air pollution, both in the workplace and in the home. In an increasingly polluted world, we must take proper measures to understand how pollution disproportionately affects marginalized communities and what we can do to bridge the gap of discrepancies. And these are our sources. Thank you for listening.